Hello, I'm Dr. Sreedevi Meka, radiologist and antenatal scan expert at Akkineni Hospitals. Hope you're safe and comfortable. We'll go over some vital points today. Stay with us and jot them down.
Welcome to this explainer. Listen, if the mere thought of breast cancer screening stirs up a cocktail of confusion, medical jargon, and, let's be honest, a little bit of anxiety, well, you are in the exact right place. Today we are completely clearing the fog. We're going to break down the science, the timelines, and the technology of mammography so you can take control of your health with absolute confidence. Let's dive in.
Here's our roadmap for today. We're going to quickly hit the early detection advantage, break down what a mammogram actually is, look at the different types of breast imaging, map out your personal screening timeline, and finally, decode your results.
All right, part 1, the early detection advantage, changing the odds.
So, breast cancer is actually the most common cancer in women globally, and it's the leading cancer in India. Which brings us to the big question. Why does early detection matter so much? I mean, why even go through the hassle of screening before you feel any symptoms at all?
Well, look at the data here. It's pretty undeniable. If cancer is caught at stage 1, way before it's palpable or has spread, the 5-year survival rate is a massive 99%. It's practically a guarantee. But if you wait for symptoms to show up and it reaches stage 4, that number plummets to about 29%. So regular screening is literally like a time machine. It pulls detection backward in time to a point when the disease is highly treatable.
Moving right along to section 2, what is a mammogram? The tool under the microscope. Okay, so what actually happens in the room? At its core, a mammogram is really just an X-ray of the breast. The machine uses low-energy X-rays to grab an image while the tissue is compressed between two paddles. Now, pause right there. I know the word compressed sounds, well, intimidating, but there is an absolutely vital medical reason for it. Think of it this way. First, compressing, essentially flattening the breast out, spreads the internal tissue. Without that step, the tissue just clumps together, and finding a tiny hidden tumor is like looking for a needle in a haystack. Second, and this is a big one, spreading the tissue out means the X-rays have a lot less thickness to travel through, and that means a much lower dose of radiation is needed to get a crystal clear picture.
And hey, speaking of radiation, let's totally put those fears to rest right now. The radiation dose from a single mammogram is tiny. We are talking about 0.4 millisieverts. To put that into real-world terms, that's roughly the exact same amount of background radiation you get just by, living on Earth for 7 weeks. It's far less than a standard chest CT scan, which clocks in around 7 millisieverts.
Okay, section 3, types of breast imaging, the technology evolution. Standard 2D mammograms take 2 views per breast, but the catch is, overlapping tissue layers in a flat 2D image can hide things. It's kind of like trying to spot a specific tree in a really dense forest. Enter 3D mammography, or tomosynthesis. This tech takes thin slice images from multiple angles, which completely eliminates that overlap problem. The result? 3D actually catches about 40% more cancers and drastically cuts down on those totally stressful false positive callbacks. It is absolutely the preferred tech right now.
But mammograms aren't always flying solo. Ultrasound and MRI are really important complementary tools. Now, an ultrasound won't replace your mammogram, but it's perfect for double-checking dense tissue or guiding a biopsy. Then you have breast MRIs. These boast a massive 95% sensitivity rate, but they do throw out a lot of false positives. Because of that, MRIs are mostly kept in reserve for high-risk screening, like if you have a BRCA mutation, or for figuring out the extent of a disease before surgery.
All right, on to section 4, your screening timeline, when to act.
Let's translate those clinical guidelines into your actual game plan. So, at age 30, routine clinical breast exams by your doctor should kick off. Once you hit 40, that's when mammogram screenings start. And notice this, for women in their 40s, the recommendation is an annual mammogram. Why? Because dense breast tissue is way more common in that age bracket, so doctors want to keep a closer eye on things. Once you're 50 to 69, you can generally shift to every 2 years. And honestly, you should keep up with screening until age 74, as long as you're in good health.
Now, there is a really important exception here. If you are high risk, meaning maybe you carry a BRCA mutation, or you have a first-degree relative who had early breast cancer, or you've had previous chest radiation, your timeline moves way up. You'd actually need an annual mammogram plus an annual MRI starting at age 30. Or 5 to 10 years before the earliest diagnosis in your family, whichever comes first.
Finally, Section 5, decoding your results, the medical report. Okay, you've done the scan, now you're staring at your doctor's report, and you see this acronym, BIRADS. Don't panic, it's just the standard grading system radiologists use everywhere. A score of 0, that just means the images are incomplete, they need a few more shots. A 1 or 2 is awesome news, it's benign, just keep up with your normal routine. A 3 means it's probably benign, under 2% risk, but they'll want a quick 6-month checkup just to be absolutely sure. It's only when you hit a 4 or 5 that a biopsy is recommended, because the findings look a bit suspicious. And a 6 means there's an already known biopsied malignancy. So once you actually understand the scale, it totally takes the fear out of reading your paperwork.
You might also catch a note on your report about breast density. First off, let me reassure you, this is incredibly common. Literally, 40 to 50% of women have dense breast tissue, which is graded as BIRADS density C or D. So why does density even matter? Well, on a mammogram, fatty tissue looks dark, but dense tissue shines bright white. And do you know what else appears bright white? Cancer. It's literally like trying to spot a snowball in a blizzard. Because of this, if your report notes dense breasts, doctors will often run a supplemental ultrasound. This extra step cuts right through the white on the image, and it helps them spot about 4 additional hidden cancers for every 1,000 women screened. It's a real game changer.
At the end of the day, all the material we've unpacked in this explainer points to one undeniable fact. Regular mammographic screening is the single most evidence-supported strategy we have for reducing breast cancer mortality. Full stop. And the great news is, access to this technology is rapidly expanding. The sources we reviewed highlight the facilities like Akkineni hospitals are rolling out this state-of-the-art 3D mammography, complete with same-day reporting and integrated follow-ups, making the whole shebang as seamless as possible.
We've walked through the science, busted the safety myths, and mapped out the timeline. Early detection is so much more than a clinical buzzword. It is a life-saving tool that shifts the odds overwhelmingly in your favor. So, with all that empowering knowledge in your back pocket, when are you going to schedule your next screening? Thanks so much for hanging out with me for this explainer. Keep learning, stay proactive, and I'll catch you next time.